Hi, I'm Dr. Navdeep. Today I'd like to talk about the few do's and don'ts after an embryo transfer. When you're undergoing an IVF treatment, the day when your doctor actually puts in or transfers the embryo into your uterus is an important day. You may feel a bit anxious, impatiently waiting to find out whether it was successful or not. And there are a few things that you should do and you shouldn't. Firstly, relax and take it easy for a couple of days. You have just undergone a potentially life-changing event, a procedure. And after the transfer, you really hope that the embryo will implant. So, the few days after which you should relax and rest. We're not expecting you to continuously bed rest, lie down all the time. No, you do not need to do that. The embryo is not going to fall out by you walking here and there. Okay? But you should reduce your physical activity. Watch some Netflix or some videos and relax. Secondly, please continue the medication. Will be prescribed a progesterone tablets or pessaries or even injections. You should continue these medications at the appropriate time as advised. It helps the embryo implant and ensures that it stays implanted into your uterus. These things may be annoying, but well, hang in there as they help. Thirdly, eat healthy. Most important thing is that a healthy mother gets a healthy baby. So you would want to continue all the multivitamins, folic acid, your vitamin D, your iron, your fish oil. So all these things will ensure that your pregnancy is healthy. Fourthly would be folic acid. Folic acid, more than 400 micrograms, reduces the risk of neural tube defects and also reduces your risk of miscarriages. So it's important that you continue this particular vitamin till at least 3 months into the pregnancy. And if in case you had a previous history of neural tube defect, where brain, skull, spine problem, then the doctor might advise you to increase the dose of the medication. A few things that you shouldn't do. Number one, you should not have intercourse. No sex after the embryo transfer, as this may trigger some uterine contractions and may disrupt your embryo from being implanted. But don't worry, it's only a temporary thing. Okay, once implanted, after your first trimester, shouldn't be a problem. Secondly, a lot of my patients will do the pregnancy test right away. Like after a few days, you'll check the pregnancy test and to check whether or not they see the 2 lines. I don't recommend that because that will increase your stress while waiting for the blood test at the clinic. There may be other symptoms which you may have. For example, some abdominal pain, abdominal bloating, okay, nausea, vomiting. All these may be related to the IVF treatment itself. For example, in patients with ovarian hyperstimulation syndrome may have these symptoms. If you have any of the severe symptoms, you should call your doctor or go to the clinic straight away. The bottom line here is that basically it's a waiting game, a few days after embryo transfer. While it's a very good idea to go by the do's and don'ts list and develop some good habits that you can sustain during your pregnancy, most of what you do in those few days probably won't make much of a difference either way. However, some low-key activity to distract you while waiting may help pass the time. Before you know it, you'll be in doctor's office and you may have a positive result.